When you get a new prescription, you want straight answers, right? No confusion. So today, we're going to clear the air about a super common question that comes up with the muscle relaxant methocarbamol. Let's get right to the truth.
Okay, so picture this. You're holding a new prescription for methocarbamol. Maybe you pulled a muscle in your back or have a nasty spasm. But then this little question starts nagging at you. Maybe it's because of how it makes you feel or just something you heard. Is this stuff a narcotic? And you know what? That's a totally fair and really important question to ask. So let's just rip the Band-Aid off right away. The clear, direct, simple answer is no. Methocarbamol is not a narcotic. It's in a completely different class of drugs. So let's dig into what it actually is, and more importantly, why people get them confused in the first place. To really wrap our heads around this, we need to understand what this medication's actual job is inside your body. It's probably not what you think, and knowing its true purpose is step number 1 to using it safely. So here's the official breakdown. Methocarbamol is what's called a central nervous system, or CNS, depressant. Its whole mission is to give you short-term relief from that sharp, muscle-related pain, from injuries like a sprain or a bad strain. Basically, it works by telling your nervous system to just calm down, which then lets your muscles relax. This chart right here makes it all crystal clear. Look at the difference. Methocarbamol is for a specific thing, muscle spasms and pain from an injury. Narcotics, on the other hand, are for more widespread, severe pain. But the really big deal is this middle line. Methocarbamol does not give you that euphoric high that people associate with narcotics. And because it doesn't, its potential for abuse is way, way lower than opioids, which, as we know, have a super high risk of addiction. Okay, so if it's not a narcotic, why does anyone even ask the question, what's all the fuss about? Well, the answer really boils down to the side effects. They can feel, well, a little weird, and that feeling is the real source of the mix-up. And here are the main culprits. It's the drowsiness, the dizziness, that lightheaded feeling. Because these can kind of mimic what people think a narcotic high feels like, it's totally understandable why their brain makes that connection. It's a logical jump. It just happens to be the wrong one. All right, so it's not a narcotic. Check. But, and this is a really big but, that absolutely does not mean it's risk-free. In fact, some of the biggest dangers come from how it plays with other substances. This is the stuff you just have to know. Remember how we said it's a central nervous system depressant? Well, think of it like this. If you take it with another thing that also depresses your central nervous system, you're not just adding the effects together, you're multiplying them. You're basically doubling down on that sleepy, sedative feeling, and that can get dangerous fast. And you'd be shocked at how many everyday things are on that list. We're talking about alcohol, of course, but also things like prescription painkillers, sleeping pills, and even some over-the-counter allergy and cold medicines. This is why it is so important that you tell your doctor and pharmacist everything you take. Seriously, even vitamins. It's the only way to avoid a really bad interaction. And this is where the rubber meets the road. That drowsiness and dizziness we talked about, they aren't just a minor inconvenience. They can seriously mess with your judgment and your reaction time. You should never, ever drive a car or operate any machinery until you know for sure how this medication affects you personally. Okay, let's get into the serious stuff. Addiction and overdose. Now listen, the point here isn't to scare you, it's the opposite. It's about giving you the knowledge you need to be in control and stay safe while you're taking your prescription. And let's start with some really good news. When you take it exactly as your doctor tells you to, the right dose at the right time, methocarbamol is not considered addictive. It just doesn't work on the brain in the same way that narcotics do. Following those instructions is everything. However, and you knew there was a however coming, an overdose is still very possible. The risk goes through the roof when methocarbamol is mixed with alcohol or other sedative drugs. That combination is, hands down, the most common reason a serious overdose happens. You need to know these warning signs. We're talking about severe drowsiness or dizziness, someone actually losing consciousness, seizures, or any trouble breathing at all. These are major red flags that signal a true medical emergency. So what do? First, call for emergency help right away. That means 911 or poison control. Don't wait around to see if things get better. And when you call, be ready with the key info.
the person's age and weight, what they took, how much they took, and when they took it. Staying calm and giving clear info can literally save a life.
Whew. Okay, we have covered a lot. So let's just boil it all down. If you remember only one thing from this whole explainer, what should it be?
This is it. Plain and simple. Methocarbamol is not a narcotic. It works differently, it's for different issues, and most importantly, when you use it correctly, it is not addictive. That is the fundamental truth. Full stop.
So now you have the facts. You're empowered. You know what methocarbamol is, what it isn't, and the right way to use it safely. The power is in your hands. Which leads us to one final thought. Now that you know all this, what's the next conversation you're going to have with your doctor to make sure your treatment is the best and safest one for you?